Have you ever brushed something off by saying, "Well, I guess that's just part of getting older"? Maybe it's the constant fatigue, the dizziness when standing up, the forgetfulness, the loss of balance, or the strange shortness of breath that seems to appear out of nowhere. Many seniors assume these changes are simply a normal part of aging. But doctors say some of these ordinary changes can actually be early warning signs of serious health problems that become far more dangerous after age 75. And the problem is, many people wait too long to take them seriously. In today's video, we'll go through 10 health changes that may seem harmless at first, but could deserve medical attention, especially for older adults. This video is for educational purposes only, and is not a substitute for professional medical advice. If you notice concerning symptoms, talk with a qualified healthcare provider. Let's begin. 1. Constant fatigue that doesn't improve with rest. Many older adults expect to feel a little more tired with age. That can be normal, but ongoing exhaustion that doesn't improve after sleeping, eating well, or resting may signal something more serious. Persistent fatigue can sometimes be linked to heart problems, anemia, thyroid disorders, poor sleep quality, medication, side effects, depression, or even early infections. One of the biggest dangers is that fatigue develops slowly. People adapt to it little by little until low energy becomes their new normal. Some seniors stop walking as much, stop socializing, and stop exercising because they feel drained all the time, without realizing an underlying condition may be contributing. If fatigue suddenly worsens, comes with chest discomfort, shortness of breath, confusion, or swelling in the legs, medical evaluation becomes especially important. 2. Shortness of breath. During simple activities, getting slightly winded after intense exercise is normal, but becoming breathless while walking across the room, climbing a few stairs, getting dressed, or speaking for long periods should not automatically be dismissed as just old age. Shortness of breath can sometimes be associated with heart disease, lung disease, anemia, reduced circulation, or fluid buildup in the body. Many seniors gradually reduce activity levels to avoid discomfort. Over time, they may not notice how much their breathing capacity has changed. This creates a dangerous cycle. Less movement leads to weaker muscles and lower endurance, which can make breathing problems feel even worse. If breathing changes appear suddenly or are accompanied by chest pain, bluish lips, dizziness, or fainting, urgent medical attention may be needed. 3. Frequent dizziness or feeling unsteady. A brief dizzy spell can happen to anyone, but repeated dizziness after age 75 should never be ignored. Sometimes dizziness is related to dehydration, blood pressure changes, medication interactions, inner ear problems, circulation issues, or neurological conditions. The major concern for seniors is not just the dizziness itself, it's the risk of falling. Falls are one of the leading causes of serious injury in older adults. A single fall can sometimes lead to broken bones, hospitalization, reduced mobility, and loss of independence. Many seniors don't mention dizziness because they fear losing freedom or becoming a burden. But identifying the cause early may help reduce the risk of dangerous accidents later. 4. Memory changes that go beyond normal forgetfulness. Occasionally, forgetting a name or misplacing keys can happen at any age, but memory problems that interfere with daily life deserve attention. Examples include getting lost in familiar places, repeating the same questions often, forgetting medications regularly, struggling with bills or appointments, or confusion during conversations. Not all memory problems mean dementia. Some causes may include medication side effects, poor sleep, vitamin deficiencies, depression, dehydration, or infections. That's why early evaluation matters. The sooner changes are noticed, the better the chance of managing symptoms, improving safety, and maintaining quality of life. 5. Losing weight without trying. Many people celebrate weight loss, but unexplained weight loss after 75 can sometimes signal underlying health problems. Possible causes may include digestive disorders, thyroid problems, dental issues, depression, diabetes, cancer, or difficulty preparing meals. Even a small amount of weight loss can reduce muscle mass in older adults. This matters because muscle loss increases weakness, fall risk, frailty, and recovery time after illness. If clothing suddenly becomes loose or appetite changes significantly, it's worth discussing with a healthcare professional. 6. Swelling in the feet, ankles, or legs. Many seniors assume swollen legs are simply caused by getting older, but persistent swelling can sometimes be connected to circulation problems, heart failure, kidney disease, medication side effects, or blood clots. Swelling that worsens quickly, affects only one leg, or comes with pain or redness should never be ignored. Fluid buildup in the body may indicate that organs are under stress. Early medical care can help identify whether the issue is minor or something requiring treatment. 7. Changes in walking speed or balance. One of the most overlooked warning signs in seniors is slowing down dramatically while walking. Research has shown that walking speed can sometimes reflect overall health status. A noticeable decline in coordination, reaction time, balance, or strength may indicate underlying medical or neurological concerns. Some people begin shuffling their feet, taking shorter steps, or avoiding movement entirely because they fear falling. Unfortunately, reduced movement often causes even more weakness over time. Maintaining safe physical activity, when approved by a doctor, can play an important role in preserving mobility and independence. 8. Persistent pain that becomes normal. Many older adults live with daily pain for years without seeking help. They may say, "It's just arthritis. It's just aging. It's something I have to live with." While some aches become more common with age, persistent or worsening pain should still be evaluated. Chronic pain may interfere with sleep, mood, mobility, appetite, and social connection. In some cases, untreated pain can also hide more serious conditions involving nerves, bones, circulation, or internal organs. Pain that suddenly changes in intensity or location deserves medical attention. 9. Changes in bathroom habits. Many seniors feel embarrassed discussing bowel or bladder changes, but changes involving constipation, diarrhea, blood in stool, urinary urgency, pain during urination, or frequent nighttime urination, can sometimes signal underlying medical issues. Possible causes range from medication effects to infections, prostate problems, diabetes, digestive disorders, or dehydration. Ignoring these symptoms may allow problems to worsen quietly over time. 10. Difficulty sleeping night after night. Poor sleep is often accepted as a normal part of aging, but chronic sleep problems can affect nearly every part of health. Sleep deprivation may contribute to memory problems, weakened immunity, depression, increased fall risk, high blood pressure, and reduced concentration. Some seniors wake up repeatedly because of sleep apnea, medication effects, pain, anxiety, or nighttime breathing problems. Long-term poor sleep should not simply be ignored. Closing. Growing older is normal. Ignoring warning signs is not. Sometimes small changes in the body can be the first sign that something needs attention. If this video helped you, share it with someone over 75 who may need to hear it. Stay safe, stay informed, and take good care of your health.